Today, we're going to be medical detectives. We're going to follow the clues, starting with a single sore on a patient's tongue, and track them all the way to a final, pretty life-changing diagnosis. Just a quick heads up before we dive in, this explainer does have some graphic medical images, so just be aware of that. Okay, let's begin the investigation.
This right here, this is the central question for us today. How can something that seems so minor, so small, unfold into something so much more serious? We're going to see exactly how doctors piece together this really complex puzzle, one clue at a time.
You know, every medical case, just like any good detective story, starts with one thing: a person who needs help with a problem. And that is exactly where our story begins. Okay, let's open up the case file. Our patient is Gurnam Singh. He's a 60-year-old farmer, and he's come to the hospital with a single, really straightforward complaint: a lesion, basically a sore, on his tongue. This is the very first piece of our puzzle.
All right, so now that we've met our patient, the next step in any investigation is to search for clues. You got to look into his personal and medical history. This is where the story of the illness really starts to take shape.
And right away, the patient's history reveals a critical detail. This isn't some new problem. This lesion first showed up 3 years ago as just a tiny spot. And over those 3 years, it has slowly but surely grown. The fact that it never healed, never went away, that's our first major clue.
And here it is, an absolutely crucial piece of evidence from his personal life. Mr. Singh has been chewing tobacco for the last 3 to 4 years. Now think about that. The timeline of this habit lines up almost perfectly with when the lesion appeared and started growing. That is a very significant connection.
So, with the patient's story down, it's time to examine the primary evidence. You can think of this as the clinical version of getting a close look at the scene of the crime.
So before we zoom in on the main lesion, this wider view gives us some really important context. The exam shows generalized staining, calculus buildup, and just poor oral hygiene overall. What this tells us is that his mouth is an environment where problems could easily start. It kind of sets the scene for what we're about to see up close.
And this is our primary evidence. The lesion is on the left side of his tongue, and it measures about 1.5 centimeters across. The report describes it as a mixed red and white lesion with papillary projections, which are basically these tiny finger-like growths. This tells us it's not just a simple flat spot. It has a complex structure to it.
Now, based on the history and the physical exam, the doctors put together a list of suspects. In medical terms, we call this a differential diagnosis. And look at this list. It's got everything from different types of cancers and precancerous conditions to just benign growths caused by some kind of trauma. Our job now is to figure out which one is the real culprit.
To narrow down our list of suspects and really crack this case, we have to bring in the heavy hitters. We need forensic analysis from the lab and the imaging departments.
These are the two key tests that are going to solve this thing. On the left, you see an OPG, which is a big panoramic X-ray of the jaw, and on the right, the histopathology report. That's the analysis of a tissue sample from the lesion itself. Together, these are going to give us our answer.
The X-ray revealed something pretty alarming: bone resorption. What does that mean? It means this lesion isn't just sitting on the surface of the tongue. No, it's invasive. It has started to literally eat away at the jawbone underneath. This is a huge sign that we're dealing with something aggressive.
So the X-ray shows us the extent of the damage, but it doesn't identify our culprit. For that, we need the gold standard. The definitive test for any cancer investigation is the biopsy. A small piece of that lesion is sent to the lab, put under a microscope, and this will give us the positive ID we've been looking for.
Okay, the lab results are in. After gathering all the clues, from the patient's story to the physical exam to the forensic tests, the mystery is finally about to be solved.
And there it is, the verdict, straight from the pathology report: squamous cell carcinoma. That little bit in parentheses, well differentiated, it just means the cancer cells still look a bit like normal cells. And that can be an important factor when it comes to how the cancer behaves and how it's treated.
So, what is squamous cell carcinoma? Well, it's one of the most common types of oral cancer out there. It starts in the squamous cells, which are those flat, scale-like cells that make up the lining of our mouth, our tongue, and our throat.
So, our investigation is closed, but the story isn't over. Not by a long shot. What can we actually learn from this case? Let's connect the dots and see why this matters to all of us.
I mean,
This slide just lays out the chain of events perfectly, doesn't it? A high-risk habit, chewing tobacco for 4 years, which leads directly to a persistent lesion that over time becomes a cancer diagnosis. The line from cause to effect is just crystal clear.
So what are the big takeaways from our investigation? First, you have to be your own health detective. Don't ignore a sore or a patch or a lump in your mouth that doesn't heal in a couple of weeks. Second, understand the risks. This case is a stark reminder that tobacco, in any form, is a major driver of oral cancers. And finally, you gotta act fast. An early diagnosis is absolutely critical for effective treatment.
So, we'll end with a question for you. This whole case began with a habit and a spot that was ignored for years. It's such a powerful reminder that the small, daily choices we make and really listening to our bodies, that is the single best investment we can make in our health. So, what's one thing you can do today for your own long-term health?